Welcome to the Global Communiques In-Depth Conversations. Today's guest is Taiwan's Digital Minister, Audrey Tang, who is in charge of social innovation. Audrey Tang is a software programmer who was one of those involved in the Taiwanese government's proactive response to COVID-19, particularly through the use of civic-related technology in the country. Thank you for joining In-Depth Conversations today, Minister Tang.
Hello.
Taiwan's response to COVID-19 has been lauded all across the world as a success story. Despite Taiwan's close proximity to China, direct flights to and from Wuhan, and a population of 24 million, Taiwan has had, as of today, 487 COVID cases and 7 deaths. Today's discussion seeks to unpack Taiwan's experience and response to COVID-19. I will separate the discussion under 5 themes. Firstly, the timeline of Taiwan's response to COVID-19 and the early and initial strategies. Secondly, digital tools and civic-related technology in response to a public health emergency. Thirdly, Taiwan's public health history. Fourthly, global politics and calls for incorporating Taiwan into the WHO, the World Health Organization, and the impact of the interplay of global politics and global public health, and the lessons learned by Taiwan in its experience dealing with COVID-19. To kick things off, I will start with the question on the timeline on Taiwan's response to COVID-19. When did Taiwan first hear about COVID-19 that was at the time only in neighboring China, and what were the initial strategies put into place in its response?
Thank you for the question. Whereas many jurisdictions learned about the novel coronavirus this year, we learned about it last year when Dr. Li Wenliang, the whistleblower from PRC, posted that there were, and I quote, 7 new SARS cases, unquote. I would learn from it as with everybody else, from this PTT, which is Taiwan's equivalent of Reddit. You see at the end of December, when there's a PTT user with the nickname No More Pipe reposted Dr. Li Wenliang's whistleblowing, it gets upvoted, and so our medical officer immediately noticed the post and issued the order that says all passengers flying in from Wuhan to Taiwan need to start health inspections. And so the order was issued at 31st of December, and starting 1st of January, all flights from Wuhan is subject to health inspections. That's the first day of 2020.
Okay. And when Chinese Dr. Li Wenliang first sounded the alarm of a strange SARS-like disease in Wuhan, Taiwan immediately responded to that alarm bell. What is the reason for Taiwan's proactive and immediate response even before the virus had an official name?
I think that's because we had a experience with SARS 1.0 at 2002, 2003 that made sure that everybody learns about the idea of a coronavirus and the impact that it could have on the entire society. Because we had to close the Heping hospital unannounced. There was an unannounced lockdown, and it caused, I think, 37 direct deaths and 73 indirect deaths from the SARS. I think everybody in Taiwan who's over 30 years old, including myself, understand the severity of a coronavirus. And so our hospital and our health care system has been doing yearly drills since 2003.
Okay. And one of China's initial responses to COVID-19 was issuing a lockdown. When the virus later spread around the world, most countries around the world drew their initial response mechanisms from China by also implementing countrywide total lockdowns. However, Taiwan appears to have had a different response mechanism. Why did Taiwan buck the trend when it came to implementing a nationwide total lockdown? And how did Taiwan manage to contain the virus without implementing a nationwide lockdown?
As I mentioned, we did do a lockdown back when SARS 1.0 happened. That was like 17 years ago, and it was very traumatic. People understand the mental health burden that it could place, especially on people working as frontline health workers, as well as this unpredictableness of like when would lockdown finally end and so on. And so because we understand the kind of mental toll that it can have on the citizens, the Constitutional Court in Taiwan after the SARS, I think it was right after SARS in 2003, 2004, they issued a interpretation saying while lockdowns of the Heping Hospital specifically was not unconstitutional, they charged the parliament to find every alternative that is better than the lockdown that would be legal. And so the parliament passed the Act for Disease Control, and also we established the CECC, the Central Epidemic Command Center, to make sure that not only that we have a kind of single point for people to call this toll-free number 1922 to get all their answers answered, but also because we started early, we could make that the border quarantine our main strategy, because we understand, as with SARS 1.0, the novel coronavirus SARS 2.0 also has this defined length, like 14 days, after which it either always shows symptoms, or if it doesn't show symptoms after 14 days, it's no longer transmissible. And so we implement a very effective 14-day quarantine regime at our borders. And that's why the rest of the country did not have to impose a lockdown, because people who return to Taiwan all go through 14 days of either a hotel-based physical quarantine or a home quarantine.
And Taiwan integrated a robust digital and civic-related technological response system in its response to COVID-19. Can you share what some of those digital tools were and are currently that are being employed by the Taiwanese government in gearing against COVID-19?
Sure. As I mentioned, maybe the toll-free number is the most important digital tool, because it calms everybody down when people can not only get their questions answered, but also make real-time improvements by proposing changes to the CECC through the 1922 hotline. There was a young boy back in April whose family called 1922 saying that the boy doesn't want to go to school because we ration mask at the time. People do not get to pick the color, and all they had was pink medical mask. And so the boy just feared that he would be laughed at by his classmates, and so refused to go to school with that pink mask. The very next day, everybody in the CECC press conference, all the medical officers, our minister wore pink medical mask, showing the minister said Pink Panther was his favorite childhood role model or something. And so the boy suddenly became the most hip boy because only he has the color that the heroes wear. And so it's this very quick and fast iterations that made sure that trust could be earned by both sides of the government and also the citizens. We also, as I mentioned, rationed the mask using digital tools. People can show up to a pharmacy with their national health insurance card. Nowadays, they can get 9 medical masks per 2 weeks if you're an adult, 10 if they are a child. And this process is facilitated through the card reader, which is very smooth. And all the pharmacists, which are not only professional but trusted by the neighborhoods, can trust the system, because everybody can, using their phone, check the map or chatbot more than 140 tools for people who queue before them to get the mask. They can refresh after a few minutes and actually see the real-time availability number go down by 9 or 10 if they're a child. And so everybody queuing after them serve as a participatory auditor of the entire system so that people won't panic. And so that tool has been developed entirely by civic technologists, more than, as I mentioned, 140 different tools. There's also the digital fence system, which is for people who do not want to go to a hotel for 14-day quarantine. They can choose to do so at their own home, but then their phone, or if they don't have a phone, we give them one, is then placed into this digital fence so that if they go out of the 50-meter or so radius is detected by the cell phone signal measurement, which has around 50 meters resolution, then a SMS is sent similar to earthquake or flood warning SMS to the local police and household managers. And so that ensure that people, when they stay in the quarantine, we give them $33 per day as a stipend, and if they break out, is 1,000 times that as a fine. So that makes sure that people honor the 14-day quarantine requirement.
Okay, so $33 per day versus $33,000 fine, is that it?
That's right.
So the digital strategy used in Taiwan saw a partnership between the government, software programmers, and civic hackers. This seems like an unlikely partnership in responding to a public health emergency. How did this relationship come about, and what are some of the fruits that have been benefited?
Mm-hmm. So I think it came about because when we first occupied the parliament in 2014, it was not just a protest against the sudden passing with no facilitation or deliberation of the so-called cross-strait service and trade agreement, unquote, the CSSTA, but actually the protest very quickly become a demo, as in demonstrating that how people can work with each other, with more than 20 NGOs, each deliberating on one aspect of the CSSTA. The idea is that even when MPs refused to deliberate something substantially, people can take, their place, literally, and participate in a direct conversation and produce actually 4 consensus items for demands that were later ratified by the head of the parliament. And so since that's occupied since 2014, the occupiers and the facilitators and people such as, yours truly, that help facilitating the communication were then hired as reverse mentors, people who may be young, like younger than 35 years old, but nevertheless advise the ministers on the direction that the society is going. And so officially making crowdsourcing, open data, and so on as national direction since end of 2014.
Okay. And many governments around the world have grappled with the use of digital tools to contain the spread of the novel coronavirus, such as apps, mobile location data tracking. And there have been concerns over individuals' data and such individuals' rights to privacy. How is Taiwan's government making use of digital tools without infringing the privacy rights of citizens? And how is the Taiwan contact tracing working?
We use only the tools that were introduced before the pandemic because people understand the trade-offs better, and the constitutionality need not be questioned that much, because in Taiwan, we never declared a state of emergency. So everything we do need pre-approval from the parliament and accountable to the journalists, to the general public, and the parliamentarians. And so we have to make do with whatever tool that was available before the pandemic. And so, as I mentioned, the digital fence is born out of this constitutional court ruling that says anything that's strictly better than a lockdown or a physical barring of people's movement, as the case of the hotel quarantine option, is preferable. And because we do not collect any additional data beyond what the telecoms are already collecting anyway, which is signal strength from the cell phone towers, we do not require people to, for example, install an app or turn on GPS or use Bluetooth. And so that made the privacy trade-off analysis much simpler to make. And the SMS warnings that the people get and the police stations get is essentially the same format as the warnings that's given for landslides warning and flood warning. And because of that, people understood that there really is no way for the SMS to kind of track people's movements. And once people are out of the digital fence after 14 days of quarantine, they also understand, because there's no like GPS or Bluetooth or whatever other signals being collected, they can rest assured that there will be no more repercussions that would infringe on their privacy or freedom of movement. And the same applies to pretty much all the measures when we use the national health insurance card to get the medical mask. People understood that similar to the drug prescription process, it's the pharmacist that can read the cards. And later on, when we also expanded to the convenience stores around Taiwan, where you can also use your national health card to pre-order the mask to the convenience store, people also understand, just like collecting the income tax in Taiwan, you can file your income tax and local taxes using your national health insurance card in a nearby convenience store. People understand that because these are not medical institutions, that there's no way for the convenience store to read your medical records. In fact, the law strictly prohibits reading it for non-public service purposes, and there's no medical data being written to the card. And so people understand that this is just for authentication only, and so on. And so basically, it's appropriating existing technology appropriately in response to the COVID without inventing anything brand new that would need another privacy review.
And in such a moment of heightened societal anxiety, there are concerns over the spread of falsehoods that could potentially fuel disorder and affect lives. Taiwan has had a particularly unique way of handling disinformation during this time. What are some of the examples of how Taiwan has handled and is handling disinformation?
Sure. In Taiwan, our counter-disinformation strategy is based on the principle of, quote, humor over rumor, unquote. So, for example, when there was panic buying of tissue papers, there was a rumor that says, and I quote, tissue papers are made of the same material as facial masks because the government is ramping up facial mask production from 2 million a day to 20 million a day. We're going to run out of tissue papers soon, unquote. And there was panic buying. And our premier very quickly, not even 2 hours afterwards, pushes out this internet meme that says in very large print, and I quote, we only have 1 pairs of Botox each, unquote. And that's a wordplay because in Mandarin, tuan, to stockpile, is the same sound as bot, tuan. And so it's basically saying stockpiling, does we really want it, and so on. And so this is interesting because the entire meme is formatted like a tissue paper box. And so there's also a very clear table saying that masks are produced using Taiwanese materials and tissue paper produced using South American materials. And that went absolutely viral. And because of that, the panic buying died down within a day or two. And it's not just a single kind of counter spam work. It's every single CECC daily press conference gets translated by this very cute dog with the name Zongchai, a Shiba Inu, that translates, for example, physical distancing. Like when you're indoor, you're supposed to get 3 dogs away from each other, and they draw this kind of ruler with 3 dogs. And then if you're outdoors, keep 2 dogs away from one another. Remember to pay your pre-orders, and then with the dog putting one of its hands to its mouth, saying that don't do what the Shiba Inu is doing. Wear a mask to protect you from your own unwashed hands. Use soap and things like that. So it makes sure that our humor, our science and clarification spreads faster than rumor does.
So humor over rumor. So one of the reasons behind Taiwan's proactive response to COVID-19 in December 31st, 2019 is, as you said earlier, its lessons from the 2003 SARS outbreak. Mm-hmm. What are some of the preparedness measures put into place as a result of the country's public health history lessons from SARS and handling COVID-19?
Mm-hmm. Yeah, the quarantining, the border quarantine is maybe the most important. And as soon as we learn about symptomatic transmission, mask is also deemed very important. We have, prior to the novel coronavirus, only the production facility of less than 2 million medical masks a day. And we understood very early on that we have to ramp up the production. So in a country of 23 million people, getting more than 20 million medical masks a day produced is an imperative because it enabled pretty much anyone who wanted a mask to get a mask. The mass rationing system ended up serving more than 95% of people. And the calculation, the numeric model, shows us that as long as 75% or more of people wear a mask and keep a social distance, the R value would be under 1, meaning that even there's some local transmission, it would not become a community spread. And so that was also very important. We also ensure that there's plenty of like hand spray alcohols being produced and made available specifically to schools, and the thermometer also. So the schools, even though it took them a couple weeks to get the thermometers, the hand sanitization, the medical masks available, the schools opened after 2 weeks of preparation. And then we never had to lock down any class, and the children went to school normally and just dined normally in restaurants and so on, even though that they may have to place some curtains or teddy bears in the seats to keep social distance. But we also made sure that people still enjoy the social nature of the community even during the pandemic.
And earlier on, you mentioned how there were yearly drills that were done since 2003
Yes.
as a result of the SARS outbreak. How did Taiwan's government maintain momentum from 2003 to 2019 in the preparedness yearly drills and planning for the next outbreak, which potentially could happen or could not happen? I mean, in this case, 2019, it did happen. So you guys in Taiwan were ready. But how did you keep that momentum going from 2003?
Yes. So in Taiwan, we have designated hospitals that are epidemic prevention facilities. And we also hold drills in even non-designated facilities to make sure that they understand how to escalate into an epidemic prevention facility. Like, for example, the staff's training, the full body smocks, how to wear the mask and gloves and things like that. And so I think it's definitely a very traumatic experience back in SARS days. And we also see, for example, when there was a threat from MERS, for example, the drill also escalated as we prepare for the worst. And so it's just a cultural thing, I think, in Taiwan, that we see the lockdown as something that we must prevent from happening again because it was so traumatic. And we understand that only when the capacity of both the testing and the healthcare staff are sufficient can we counter the virus at the border without getting into a full lockdown. And so I think that's what motivates everybody in the yearly drills.
And shifting the conversation now a bit to global politics. Taiwan's efficient response to COVID-19 has given a spotlight on the interplay of global politics and global public health. Taiwan is excluded from the WHO. What are your views on the impact of Taiwan's exclusion from the WHO and the global response to COVID-19?
Well, in Taiwan, we have very limited scientific access through the WHO, but we do not have ministerial access as the WHO member countries do. And the significance, I think, is really amplified by this current pandemic, because when we wrote to WHO to ask for more information about human-to-human transmission last December, the 31st, had we had ministerial access, we will be able to reach directly to the decision makers in all the different countries, so that when a few days later, when we started our own Center of Epidemic Command Center, even before we have the first locally confirmed cases, we will be able to compare best practices and also signify the seriousness of the human-to-human transmission aspect. However, barred from the ministerial access, the world will basically spend 10 more days following the then WHO guideline of not doing health checks or border quarantine for people flying from Wuhan, and therefore collectively lost 10 days when it comes to early response. And in Taiwan, of course, the top epidemiologist of of the country at the time, VP Chen Jianren, is also our vice president. And so he could also coordinate not only with political authority, but also with epidemiologists in other countries. But in other countries, unless their top epidemiologist, happen to be a vice president, getting the scientific access and the scientific case through is not the same as affecting their decisions.
And how has Taiwan's effective handling of COVID-19 and calls by the likes of Canada and Japan for Taiwan's inclusion into the WHO affected Taiwan's relations with China?
Well, we had our own pre-World Health Assembly digital meeting, as this year's World Health Assembly was also digital. It was also online. We held our own 14 economies call that shared the best practice, including the humor over rumor, to medical officers, including Secretary Azar from the United States. And I think the main idea is that health for all must not fall prey to politics. All we're asking is that we can save more lives if we, for example, share the memes that we have on associating mask to hand washing sooner. Like this very simple idea, as you see, for example, from the Czech Republic and so on, successfully adopted and made sure that people build a new culture around responsible mask use. Something that I'm very happy to see that the WHO is now starting a wear mask challenge that I think is a great thing to have, and I'm sure that we can also help spreading the message. And so, yeah, I don't really think it is something that is a zero-sum game. The more we collaborate, the sooner we collaborate with other top medical officers, the better.
And given Taiwan's exclusion from the WHO and Taiwan's proficient response to COVID-19, has Taiwan developed bilateral relations with other states in order to share its best practices with other countries around the world? You've just shared now that you had your own digital assembly, but there are countries around the world, including developing countries, that very much make use of Taiwan's expertise in time.
Yeah, definitely. We not only work with countries that maintain official relationship with us, for example, Eswatini in Africa, but we also work in kind of epicenter to epicenter diplomacy through the video calls. We have dedicated not only the medical mask and the supplies, but also the shared the blueprints of how to make, for example, 2 million medical masks per day in an automated factory to the countries in need. In Taiwan Can Help That Us, which is a website made by the civil society detailing the kind of bilateral help that we have given. You can see even the civil society, the ordinary citizens in Taiwan, there's more than 700,000 of them, totally dedicating more than 6 million medical masks from their quota of the ration mask for our foreign service to donate to humanitarian workers abroad. And so I think one of the main things that we can help, aside from, of course, collaboratively develop vaccine and pharmaceuticals, is just making sure that our tools, the technical tools, the digital tools that preserves and even enhances privacy is shared as examples to other jurisdictions, so they don't have to make this kind of false decision between human rights and democracy on one side and public health and epidemic prevention on the other. In too many jurisdictions, this is seen as something like a trade-off, but Taiwan proved that we can strengthen human rights and democracy during the pandemic while fighting off the coronavirus. So for example, South Korea, they have civic technologists that took Taiwan's mask availability map developed by Finjen Kiang in Tainan City into their own mask availability map and eventually convinced their government a month after we did to open up the API. And we also work with, for example, the Tokyo metropolitan government to visualize the dashboard of the COVID situation with code for Japan. The list goes on. So I think we are very happy to help however we can, specifically because we have more research and development capabilities now because we're relatively COVID-free here.
And Many countries around the world as well are still grappling with how to contain the spread of the novel coronavirus. What do you think are some of the things that some countries, including developed and very powerful countries, in addition to those that are low income and developing countries, what are some of the things that some countries have gotten wrong? And what can they do better, you think?
Well, I will first say what we have got wrong. Before we learned about the full characteristics of asymptomatic transmission, there was for like 48 hours back in February that we said publicly, our spokespersons and the doctors said publicly that the medical masks are important material that we need to ensure plenty of supply for our frontline medical workers. And so if you are healthy, and if you're in a well-ventilated place, you do not have to wear a mask. It does not protect you that much. And it's a wrong message to send. And after 48 hours, and specifically after the ideas about asymptomatic cases begin to solidify in the scientific consensus, we very quickly said, no, we're ramping out the mass production and we're rationing out, and please wear a mask when it's a densely packed room and you can't keep the social distance. So we corrected ourselves just 2 days afterwards. But for many countries, that correction would not happen until variously in May or July or even August. And so people would have lived for a long time believing that wear a mask is more like a symbol of solidarity or a kind of social respect thing, and not understanding that a mask can really protect oneself from one's own unwashed hands. And I think that is the kind of main idea change that many populations are now working with. And that is also why WHO has to now start a wear a mask challenge to convince people worldwide that mask really is useful and indeed required, specifically in like public transportations and so on.
What are the lessons that Taiwan and its government have learned during this unprecedented time? You've just reflected on some of the things that you did wrong, but later corrected. But what are some of the lessons that you have learned during this time that you think are beneficial both to yourselves in Taiwan, but also to other countries around the world?
Sure. I think pandemic not only harms public health, but there's also the infodemic that decimates the cornerstone of society, which is trust. Right, all the closing of borders, lockdown of cities, suspension of activities seems to brew mutual distrust that we can see specifically like on social media. And so not only is the humor over rumor important to spread the science, it's also to hold off a likelihood for people to blame the spread of virus on outsiders, for example, people of different races, different nationalities and beliefs. But the scientific fact is that if you are a Homo sapiens, if you're a human, you're not unlike any other human when it comes to coronavirus. And so I think this solidarity, this global solidarity really is very important. The other thing I would also say is that what I call the Pygmalion effect, like believing the citizens, trusting the citizens. Our minister Chen Shizhong never jumped to defend existing policies. Whenever there is a new idea, a good idea from the civil society, he always is humbled by it, learns it, and amplify it in the daily press conferences. For example, in the camera, you can see a small rice cooker and a larger traditional rice cooker. And these are brought up by a professor, Lai Chunyu, who, contrary to popular belief, proved that a traditional rice cooker, if you don't add water to it and just steam it dry, entirely dry, and if you control the time sufficiently, like to exactly like 8 minutes, you can reuse this mask for 3 to 5 times because it kills the virus, but the heat only goes very briefly, so it doesn't destroy the structure of this medical mask. Because it's very counterintuitive, the Drug and Food Administration in Taiwan did not initially endorse the idea, but eventually they do their own tests and prove that Professor Lai Chunyu was right all along. And so in the daily press conference, Minister Chen Shizhong invited Professor Lai to share the theory behind it, while he, the Minister Chen himself, start cooking the mask like in the front of the entire nation. And so I think nowadays we also see international institutes proving that you can also use the same technique for N95 mask if you cook it longer. And I think it's very important to keep this precious supply fresh and when we are fighting off the pandemic. And so just trusting the citizen. The more trust we place on the citizens' capability to innovate, the more trustworthy the citizens are.
And on that note, on trusting the citizens, Minister Audrey Tang, Digital Minister of Taiwan, thank you for joining the Global Communiques in-depth conversations today.
Thank you.